The second phase of the electronic prescription service in England is primarily targeted at patients that are on repeat prescriptions. In most cases, it simply replaces the paper script with an electronic version that is sent directly to the patient's chosen pharmacy. Since the electronic prescription service is aimed at those patients on repeat medicines, this is likely to be around 80% of your patients. Since this is such a significant part of your business, it is vital that you capture the nominations and register them with your pharmacy as soon as possible. The nomination process doesn't need to be complicated. However, the rules surrounding nomination do state that there should be an auditable process in place. We therefore strongly recommend that you capture nominations in writing. We are aware that there is some monitoring of nominations, and therefore should you have any challenge regarding your nominations, by capturing these in writing you will have an auditable process should you face that challenge. It's absolutely imperative that you start capturing nominations straight away. You probably know the number of items that you do in your pharmacy, but do you know the number of patients that your pharmacy has? The electronic prescription service is aimed at those patients on repeat medication, which is probably about 80% of your patients. So if you had 5,000 patients in your pharmacy and 80% of these were on repeats, then that's 4,000 patients for which you need to capture a nomination. It's suggested that a nomination might take 15 minutes. This includes the time taken to explain the process and the service to the customers, capture their signatures, and then enter that information onto the spine. If you think about 4,000 patients at 15 minutes, this could potentially take one person in your pharmacy up to 6 months just to capture these nominations. Clearly that's too long a time frame, and in the meantime other pharmacies could capture your patients. There's a common misconception that you can't nominate your patients until your GP's surgery has gone live, and this simply isn't the case. As long as your computer has been upgraded, which it very probably has, then you can start capturing the nominations. Another point to consider is that the nominations don't expire. What you will need to do though is in the interim your patients will have paper scripts, so when they come in and bring their paper script, then just have a quick conversation with them, reminding them that you are their nominated pharmacy and that they don't need to do anything else. When a repeat prescription is received in your pharmacy, this should trigger the nomination process. The person looking after that script will be able to identify those patients that still need to nominate you as their chosen pharmacy. To help you with an auditable process and capture this nomination in writing, Newmark have produced a pharmacy nomination form. We suggest that prior to that patient returning to your pharmacy, you complete the patient information. This can be done manually by completing the form or by adding a duplicate bag label. One of the pieces of information required on the form is the NHS number. It's not vital that you have this number, but experience tells us that this will significantly reduce the amount of time it takes you to add that nomination onto the spine. Some pharmacies have captured this by having it added to the bag label. Once you have that information on the form, attach this to the completed items. Then when the patient returns to your pharmacy, it will act as a reminder to the member of staff looking after that customer that they need to capture the nomination. The form is designed to take you through the common questions that a patient might ask you. Once you've explained the service to that customer, they simply need to read the back of the form to understand what they're signing for and then to sign it. The form is tear off, which you can keep for a later date for nominating those people onto the spine, and then give the patient the information leaflet to take away with them.